Hello everybody, welcome to another presentation of the kind of life-changing work that my team and I here at London Dental Specialists carry out on a routine basis. If you like our videos, please don't forget to subscribe to our YouTube channel and also follow us at London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. It's about this 51-year-old gentleman who referred himself to see me after having spent, years beating himself up about the state of his teeth. And sadly, this is actually not it's very common for patients with gum disease to literally beat themselves up because of the extent of the disease or the severity of the disease. And I want to start by saying, please, if you have gum disease, extensive gum disease especially, that's what dentists like me exist for, okay? It is not your fault. We are here to help you, okay? So let's go into exactly why this gentleman was beating himself up so much. It's not glaringly obvious from this photograph, but when I show you a retracted shot, like I've shown you here, you can see that this upper left front tooth, or the upper right lateral incisor, is literally hanging in his gum, and all his teeth on the right side, or most of the teeth on the right side, are missing, and you'll see in a second what those teeth look like. So here we are on the right side at the back. There are no teeth to eat with, and that was the other problem. He just got to a point where he couldn't eat properly. Again, on the left side, look, these teeth, the gum should be here. You can see the gum is up there. His teeth were really loose. There's no way he could keep it clean. He could eat properly. But interestingly, he always kept those teeth clean. But there was nothing. In this case, the ability to keep these teeth clean says to me, this is a highly motivated gentleman, and the results are going to be successful without a shadow of a doubt. And you've seen this picture. So as is customary, we took an x-ray, and for those of you who have been watching my videos, you will know that the green line represents the current level or the current bone levels, okay? And the yellow lines here represents the position of the tips of the root. The green in health, the green line and the yellow line should be nowhere near each other. The green line originally would have been here, and then slowly over time, because of the gum disease, it slowly moved up towards the yellow line. The moment you see them begin to overlap like this, you therefore know that the teeth are going to fall out. And this is just an example. By the time the gentleman started treatment, those teeth had actually fallen out on their own. So ultimately, there are two ways of dealing with this gentleman's problem. Okay, he wants to be able to smile with confidence. He wants to be able to eat with confidence. There are two ways. Option one is an older technique that's been used for centuries. It's a removable denture. It works and works very well. Okay. Or option two is a more modern option. Some people call them modern day dentures. Some people call them same day teeth. They all mean ultimately the same thing. It means extract the remaining teeth, place somewhere between 4 and 8 dental implants, and immediately on the same day attach a bridge of approximately 12 teeth. Okay, so option one is a removable option. Option two is a fixed option. Now, as I said to you, the removal options work very well, but for this gentleman, he says, I'm 51, there is no way I'm even prepared to consider the possibility of having a set of teeth that I can remove. So I said, of course, we can acquiesce to your, go with your desire to have fixed teeth, because fortunately he had enough bone for that, and that's exactly what we did. So this is where he started. So he came into my practice at 9 a.m. and left it was either 5 or 6 o'clock that evening, like that. Now, I must say to you though, he wasn't able to smile very much at this stage, again, because his lip was completely numb. So let me show you exactly what it looked like in his mouth when we pulled the lips out of the way, so you can see. That's where we started. Look at this beautiful, beautiful same day teeth that were already pre-made by the technician. I will never forget it, because when he left looking like that, you could see him standing up just that bit taller. It gives me and my team great joy to see that. Now, this is what the set of teeth look like. They're all linked together, and they can all be screwed into dental implants. Now, it is really important that although all of this can be done in a day, and it can be done safely in a day, okay, the deal is, if you have that all done in a day, okay, you have to have a soft diet for 2 months. Okay, it takes that long for the implants to have healed enough to be able to take more substantial food. So for those first 2 months, they are there for cosmetic purposes only. And as you can imagine, even on the temporaries, this gentleman was extremely happy. Okay, now let's look at what the final set of teeth look like. Okay, so this is where he started. Same smile. Look at that. Absolutely stunning. Look at that smile. Look at that smile. It's not too surprising that he was back to his normal self. Therefore, extremely grateful for what we did. How long did it take? 4 months. Not long at all. It takes 3 months for the gum for the gum and the implants to heal, and then after that, approximately a month or perhaps 6 weeks to make these new porcelain teeth. Stunningly beautiful porcelain teeth. At London Dental Specialists, we always offer a 10-year warranty on our dental implants, as long as you maintain them the way we show you. If anything goes wrong with them, it's on us. Because of the quality of the materials, the quality of the laboratories that we use, that is why it costs you £18,000. But we promise that represents a phenomenal value for your investment, and certainly this patient agreed with that. And because we aim to treat everyday people, we always have finance options available. So patients with periodontitis out there, or perhaps ill-fitting dentures, please stop suffering in silence. There is a solution. It works, and it works very well. So pick up the phone, send us an email, tell your dentist to refer you to us, and we look forward to starting you on exactly the same journey as this gentleman, and we look forward to meeting you soon. Many thanks.